Hey, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
So today's topic is total knee replacement.
Yep.
And the question is, should I have both my knees replaced at the same time?
So very common question, very controversial, and probably there's not a specific answer. So ultimately the decision will come down to you and your surgeon, but there's a bunch of things that will factor into your decision. So Paul.
So thanks for watching.
Yeah.
No, I'm just kidding. Yeah, we can talk about
What's
it.
your general approach? What do you tell people?
Well, first of all, you got to make sure you have arthritis in both knees. That's
Of
very
course.
bad and has exhausted all non-operative means before you even consider a knee replacement on both sides.
So assume we're at that spot.
Okay, so we're at that spot. Then I say no.
Okay. Why?
My reasons for no are as follows. One, it's a lot of surgery.
Agreed.
Not
For you
only,
and for the
yeah,
patient.
for the patient and for me. That's a lot of surgery to do both knees. Okay,
Yeah.
but then you say, well, what about two teams? Have two teams come in?
You could.
Okay. Two, not everybody loves their knee replacement. We've talked about this before.
Like 4 out of 5. Like
We'll
it.
talk about it again. Yeah, 4 out of 5 like it. 1 out of 5 aren't totally satisfied with their knee replacement. If you are one of the unfortunate people that is not satisfied with your knee replacement, you'll be very happy if you only did one and not both. That's relatively speaking very
Yes,
happy
of
because you're not happy with your knee replacement. But
Right.
you could be doubly unhappy if you had both done.
I would agree. Yeah.
Okay. And the third reason is I think the rehab would be very difficult with both knees.
Yep.
For mobility and stuff and getting you home and walking around because you want to have at least one good leg to stand on for a while
Yep.
until your other knee heals. Those are the main reasons.
Those similar. I agree with you. In general, it is not part of my regular practice. I tell particularly older people, there are some scientific studies that show that beyond 70, there is a slightly higher risk of things like heart attacks and strokes. So that's one reason to consider not doing it. Two, you lose twice the blood. With advanced blood-saving techniques, I think that's become less of an issue. Three, one knee replacement is really, really painful. By far the most painful operation that we do. So two of them, I can only imagine would be doubly painful, which is very, very difficult. Getting around, I think, is a very difficult thing. And often when we see people that have, one fresh replaced knee and one other knee, like it takes a lot of work to get around. And if you have two knees, then that's a problem. The other thing for me, like you said, is that if things don't go perfectly well, so if you got an infection or if you end up getting a stiff knee or if you had a blood clot, then you have potential to have irreversible complications on both sides rather than on one. So I agree. I usually space them 3 months apart. Is about as close as I like to do them. And people do well with staged procedures. I understand that if you're self-employed or you have to take off work, that's complicated.
Yeah.
But in general, for me, I think the risks and benefits lean for me to do them staged.
I have one more sneaky reason.
Okay.
It's a sneaky reason, but sometimes
Yep.
when you replace one side, the other side actually feels better. So let's say you had bad arthritis in both knees. You
Yep.
replace one, and then sometimes the other side feels better because you're taking more load on the
Yep.
on the replaced side. You're able to let that one pick up the slack. So the other one sometimes get better, and you can put off the other knee replacement for a long time. Now sometimes it gets worse because you're more active, and the other one declares itself. But
I'd agree.
also sometimes the other one gets better. Now listen, I've had patients who have had both done at the same time and
Yes.
done very, very well.
Sure.
Especially in my fellowship, I remember we used to do them at the same time. Sometimes one of the happiest patients I can recall is someone who had them both done at the
Yeah.
same time.
So their trauma may be greater, but they forget it because they only had to do it once.
And they never have to do it again.
That's right.
So
So there you go. Food for thought.
yeah, opinions here really, just our
Yes.
opinions. The literature, by the way, the scientific literature is split on this. Some
Yep.
articles say, yeah, do both at the same time. Others say don't. So it's down to our opinion, and my preference is not. to do
And if
both.
that's what you want, you just search out a surgeon that does both at the
Yeah.
same time.
Yeah.
Yeah, they certainly are out there. So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.